All right, hello and welcome to today's webinar, where we are going to look at some live documentation for Facet interventions. My name is Mary Sue Gardner, and I'm a registered nurse on the Provider Outreach and Education team here at WPS. Now, today's webinar is an extension of yesterday's webinar. There is not a new slide deck for today, but I am going to refer to some of the slides from yesterday's presentation to help guide us today. So with all of our presentations on your screen and as well as in the slide deck is our disclaimer. And basically our disclaimer says we prepared this information using the current laws, rules, and regulations as they stand today. If the laws, rules, and regulations change tomorrow, it's your responsibility as a provider to make sure you are following the Medicare rules that are in effect on the date of service that you're providing them. We're going to provide answers to your questions today based on the current laws, rules, and regulations as they are today for Facet interventions. And also CMS does prohibit you from recording this presentation for profit-making purposes. Since we don't know why you would be recording it, and we can't guarantee you wouldn't be using it for profit-making purposes, we do ask that you stop recording if you are doing so, or please do not screenshot copies of the presentation. Again, that's all the information's available for you. And we are going to record this for you, and we will post a copy of it to our Encore page for today's event. All right, on your slide is also an acronyms list, and these are the most common acronyms that I may refer to at some point today. So if I say something that you don't know what the acronym is or I haven't identified it before, please just refer back to this slide. Now, this was yesterday's objective and agenda, and I'm going to reuse it again because it's pertinent to what we're doing today. By using live documentation examples, I want to help you to be able to streamline your prior authorization requests for Facet interventions. We're going to accomplish this today by actually looking at documentation in the form of live examples and comparing that to the requirements for the prior authorization requests for your Facet interventions. By using these live documentation examples, I want to show you how documentation can sometimes lead to non-affirmed prior authorization requests, or can even lead to affirmations being affirmed on the very first request. Now, I am going to review the first couple of slides of yesterday's slide deck because it's pertinent information that we're going to refer back to as we go through some of these documentation examples. So we're going to start by talking about the prior authorization request forms for Facet interventions. One of the biggest reasons for non-affirmed decisions right off the bat is the request forms don't always contain the information that we need to know about the service you're going to be providing. So as we go through the documentation examples today, I want you to pay close attention on how you can better use this form and use it to your advantage to help you receive an affirmed decision the first time. So some of the key points that you should have on your prior authorization request, whether you're using this form, which is actually a snippet from the downloadable form, or whether you're using the form on the provider portal, the online form that you fill in when you are submitting via the portal. Some of the information and the key points of things that we need when you are filling out this request is not only the CPT codes that you are planning on providing, as well as any modifiers and units of service, but we need to know which or what service you are providing. Is it a medial branch block or an MBB? Are you doing some sort of Facet denervations or RFA, or radiofrequency ablation? Is it an intra-articular injection or an IA? And then we also need to know what levels do you plan on treating, as well as, is it going to be a diagnostic or therapeutic, and is this the first or second or repeat injections? So you can see in this example on your screen, which may be, not as easy to see, but it will be when we show the live examples. We have the 64490 and the 64491 here. They've said they're going to use the 50 modifier, meaning it's bilateral, 1 unit of service for each level that they are reporting. And down here, they gave us additional information. So they're going to do L1, L2, and L4, L5, and it's going to be first diagnostic MBB. So you can see that gives us a whole lot of extra information. In the absence of this, these codes could let us know that any one of these is going to be done. We don't know a level. We don't know if you're planning diagnostic or therapeutics. So we do encourage you to give us that additional information in the additional information section. And again, I'll show you examples when we're looking at the documentation of what that would look like if you're doing portal submission. So as we move on, all prior authorization requests, and including your first MBB request for diagnostic, this is all the documentation that you need to submit, as well as your prior authorization request form. So things that we're going to look for in your documentation, we need to see that history of at least 3 months of documented pain with a failure to respond to non-invasive conservative interventions like therapy, medications, etc. We need to see that the pain is predominantly axial and causes functional deficit, and that it's measured on a pain and or disability scale. And you should consistently measure using the same scales before and after every treatment. Pain assessment scale needs to be done, and a summary of the patient's pain, and that includes the type of pain they're having. Is it sharp? Is it stabbing? Does anything make it better, etc. And then an assessment with relevant medical history by the provider pertaining to complaints of back or neck pain. So at this time, I'm not going to continue with this slide deck, but instead, let's look at some actual live documentation. Now, before I pull that over, I just want to acknowledge that there were several pre-submitted questions for this event that we actually did cover in yesterday's session. So if you did not have a chance to join yesterday's event, that's okay. The encore of that event will be posted to our YouTube page within the next 15 business days. And you can access that event from our encore page under the training menu of WPSGHA.com, or you can go directly to YouTube and go to our YouTube channel. Just type in WPSGHA and our YouTube channel will appear for you. Again, if you didn't download the slide deck from yesterday, I do encourage you to do that. I went basically slide by slide on each different type of request and what documentation was needed for each request that you submit. So I'm hoping today that actually seeing live documentation really drives home what we're looking for and how to improve your own documentation for prior authorization requests. So let me pull this over. And I'm going to ask my co-host, Mary, if she is seeing the documentation example.
I can see this example.
Okay, perfect. I figure you were just having a little bit of a mute issue, Mary. Thank you so much for verifying. Okay, so we can see on your screen, this is a prior authorization request that came in and said it was vein ablation. But as we scroll down, we can see that the CPT codes that were requested are the 64634, which is that, made the notes here, destruction by neurolytic agent, paravertebral facet joint nerves with image guidance, cervical or thoracic, but this one is for each additional spine. So this isn't the initial. And then they have a diagnosis here for primary osteoarthritis of the right wrist. And then their second CPT request was again for the destruction by neurolytic agent, for facet joint. This one is lumbar or sacral, and this is for each additional. And again, the diagnosis to support these, and I just made these notes just so it was easy for everyone to see, it's primary osteoarthritis of the right wrist. So lots of confusion to start with because the request starts out with vein ablation, and then the request gives facet prevention CPT codes, but a diagnosis of a wrist arthritis. So we're just going to scroll down and take a look at some of the additional documentation. If you were on yesterday, you remember that I mentioned many times that it is of utmost important that you utilize the additional information section and let us know what kind of additional information is necessary. And we went over that on that slide. And you can see they utilized this comment section, because this was a portal submission, to give us the diagnosis code. Again, for facet interventions, it would be best to give us what type and what levels you are treating. So as we scroll down and go into some documentation, you can see that the documentation does support that it's primary arthritis of the right wrist, and that they are planning, they have a degenerative joint disease of the wrist, and the procedure they're planning is right wrist denervation, and using a bear block for that. And then additional information about the patient. So she's got complaints of wrist pain, etc. And then everything goes on to give information about the wrist pain. I don't really need to scroll any further on this one for you to get the gist of the documentation and the issue regarding this. Obviously, this request was non-affirmed. First, the prior authorization request form was completed incorrectly because it starts with a request for vein ablation, but then gives the codes down here for facet interventions, cervical and thoracic, lumbar sacral, both to be second injection, no primary, and a diagnosis that doesn't support this at all. We're looking at a whole different area. We're not even looking at the back, we're looking at the wrist. So if a provider was actually doing a denervation procedure to the wrist, there is no prior authorization process for that procedure. The CPT HCPCS codes that the provider planned to report in this case were incorrect since they are for facet joint. So as we move on, that was a pretty straightforward one, and you think, well, that doesn't really happen. And I wanted to show you documentation examples of why it does. First of all, just a FYI for anyone that submits prior authorization requests, remember there are certain services, certain CPT codes that require prior authorization if they are performed in the hospital outpatient department of a PPS hospital. Not a critical access hospital, not an independent surgical facility. They have to be on a 13X type of bill, and they have to be performed, again, in a PPS hospital. And I am just going to go to WPS's website really quick, and I'll go back to the homepage to kind of show you how I got here. I'm going to choose Part A, and I'm going to choose the Topic Center of Medical Review. I'm going to scroll down into Prior Authorization, and I'm going to choose Prior Authorization for Facet interventions or Facet interventions, depending on what country, part of the country you're from, depending on how you say that. And so here's all of the codes that require prior authorization if they're performed in the hospital outpatient department. If they're not included on these, they do not require prior authorization. So a wrist denervation would not require prior authorization request. All right. So as we move on, and let me slide this up to the top, I'm going to show you the next example. So in this example, this is a request for facet interventions. And then we go down here and we get the information on the CPT code. And this is an injection, lumbar or sacral level. And they're requesting 2 units on this one. And their anticipated date of service is 1/17/2024. So let's go down. Remember, I can't encourage you enough to utilize the comments field. Tell us what you're planning on doing, whether it's an MBB, whether it's an IA. You know, those are an RFA, that's the information we need. We need the levels. We need if it's the first, second injection. We need to know if it's diagnostic or therapeutic in nature. So we have none of that information utilized in the comments. So let's see what we can find in the documentation. All right. So as we scroll down, we have a little information from the office visit that this is lumbar facet joint pain. And here in the HPI, I've just highlighted a few things just to note. So this was, I have my dates right, 7/18/2023, and this request is for 1/17/24. So this gives us some history of this person's issues and how long they've been seeing the physician for. And so here we see that she's in 2023 to review the MRI. She had fusion from L3 through L5. In 2023, she was rating her pain as 5. They started to talk about injections at that time, that the pain was axial. So as we scroll down on to, this is just some medications and review of systems that she was on at the time. And we get down to the impression by the physician. And so we can see that on this page, perhaps that there's some procedures that they are starting to plan and think about based on some of the changes of, or some of the indications noted of her MRI. So we have some mild bilateral neuroforaminal stenosis at L4 or L5 to S1. All right. And then again, axial and pain, 8 or 9 on the pain scale, and they want a trial bilateral L5-S1 facet block. So that's the first indication. Back again, and I can't stress enough, you know, we're looking at history, and this was from 2023, 7/18 of 2023, and then this anticipated date of service is 2024. And again, lumbar sacral, so that kind of, you know, lines up. They're still in the same area, but we don't have that information in the prior authorization request to line up. All right, let's see. So really, it's still unclear if this is going to be an MBB, an IA, if it's diagnostic or therapeutic. We do have some information about pain and pain assessments, and we have the PEG score here, and so we know that it's interfering with some ADLs, and we have PEG score totals. So all, you know, additional information that we need regarding this patient. So again, the PEG information, and I'm trying to scroll a little bit slow as to not cause this to be an issue as people are looking at it. So again, here's a little bit of information in her history and how she describes her pain, that she's tried Tylenol, fentanyl patches, Norco for the pain control. She had physical therapy in 2022. Again, a history of effusion, L3 to L5, and more description of the pain and how it shoots. And then we also can see we have information about medications that she's taking to help with the pain too. And then as we scroll down, I can't remember if there's anything else. We have the information from her MRI or imaging to give a little bit of additional information. And then I think the rest just kind of ends with, here's the big interpretation of the MRI, you know, and significant history. So let's go back and ascertain what we can get from this initial request. So one thing I want to do is I'm going to bring up the slide deck from yesterday. And we'll start back here. They didn't identify what type of injection that they were going to do or what type of intervention. They didn't identify on the request what levels are to be treated, if it was diagnostic or therapeutic. And again, as we move on, then these are the additional things we're going to look for. Now, we know we have a history, and we know she's got failure to respond to non-invasive therapies. And we had documentation that the pain was predominantly axial, and pain scales and assessments. So the things that we were missing are, know what they want and what they're actually planning to do. Without that information in the documentation, if it's going to be MBB, if it's going to be IA, if they've moved on and they're planning on an RFA, if it's diagnostic, if it's therapeutic, etc. So those were some of the things in this documentation that were missing that made this claim not affirmed on initial request. So again, make sure you're utilizing not only the comments field to give us that additional information about the levels, about the type of injection, etc., but also make sure your physician is noting in their plan what they plan to do, where they plan to do it, and if it's diagnostic or if it's therapeutic, if it's a first or second time that they are doing it. All right, we're going to move on to another example. So again, another example, this one is coded appropriately for Facet. And we have an anticipated date of service of January 12th of 2024. And we've got the CPT code 64493. And then in the comments, they just put 64493 and 64494 for this one unit of service. There's no modifiers listed. So we know we have diagnostic, therapeutic, injection of lumbar sacral second level for the 64494. So what do we know from this documentation? As we scroll down to the history, 3/8 of 23. So we're again, this is the next year the request is being made for. And then we're going to give us some history from service dates back starting in March, so we get a better idea of this patient and what's going on. So the patient in March presented for a trial of epidural steroid injections. So history for this patient, you know, says they've had some prior back surgeries, so we're starting to get a little information. The plan at that time was to repeat the epidural steroid injections. As we move on down, we have an op report from that same time period back in March of 2023. L4, L5 epidural steroid injection was done, and a little bit of information about the description of the procedure, that it was at L4, L5, and what kind of solution they injected at that time back in March. And then as we scroll down to this page, so then we can see in December, this patient returned to clinic. So again, they give the history. She went in March for the lumbar epidural steroid injection. And at that time, she stated she had absolutely no relief from the epidural steroid injection and did not follow up to do any repeats. So she's had continuing back pain, it's shooting. When she stands, it's minimal, it's aggravated, you know, walking, reclining makes it better, blah, blah, blah. So we have that background information. Axial in nature, a little bit more information about the pain, and depending on how position she is how that pain may or may not be aggravated. She's done physical therapy several times. She's done stretching exercises, all without improvement. Prior epidural injections without any improvement. So tests were positive for Facet joint disease, but negative for SI joint disease. The Facet loading reveals tenderness on the left side, positive, was positive, negative on the right side. The recommendation then is to proceed with diagnostic MBB joint nerves on the left side, and that they're wanting to schedule her in January, which coincides with the date of their request. However, what are we missing here? We're missing the levels. So we know now, getting to the end, that they want to do diagnostic MBB, but again, this should also indicate if this is the first time, the second time, and the levels that the physician is planning to do the injections at. So again, on initial prior authorization request, this would be non-affirmed because we don't have that information, neither in the documentation nor on the prior authorization request. And both need to match. It really needs to, it has to be in the documentation. We have to find it in the documentation from your physician, what intervention they are planning, what level they're planning at, if it's diagnostic, if it's therapeutic, and if it's first time, second time, repeat. All right. So enough of the bad, let's move on to the good. I'm gonna scroll up really quick because it's easy for me to show examples of things that don't get affirmed on the first time. But I wanna show you examples of ones that did get affirmed on the first request. So again, Facet intervention, as we scroll down, now you can see how this was utilized a lot better by this provider. So again, the 64493, again, that's lumbar sacral, single level. They've set a modifier 50, so they're planning on bilateral, 1 unit of service for this level. This would be the first diagnostic bilateral, which they didn't necessarily need to include that, but because it's here, but it's nice that they do that. L4-5 medial branch block. And then they're anticipating also doing the 64494, so the second level. Again, bilateral, 1 unit. Again, this additional level is going to be the first diagnostic bilateral, but this one's going to be at L5S1, and it's going to be the medial branch block as well. So as we scroll down, again, you can see a little bit of information, the information they gave to their scheduler. Oops, I have a habit of doing that, and then I highlight the whole page. I'm so sorry. Again, says first diagnostic, L4-5, L5S1 Facet. So they're telling the scheduler, it's in the documentation that that's what they are planning. And then we have the diagnostic imaging results of this patient and the impression of the imaging results that she's got some, I think, call all of these females. I'm not sure if they all are or not. Anyways, some multi-level degenerative disc disease, facet arthrosis, at L4, L5, L4, L5 again noted, etc. And then we have a little history. This is a recurrent. This current episode has been more than a month. It's constant occurring. The pain severity is an 8 out of 10. Worsened during the day, aggravated by positioning, associated symptoms, et cetera, et cetera. They do tell us it's axial in nature. It increases with the facet loading. Again, MRI. And then down here we have the surgeon's plan. So this patient reports axial lower back pain with facet degenerative joint disease on exam. They failed to respond to 8 weeks of PT, over-the-counter and pain and prescription pain medications, activities. They give us the ODI score for her disability, and they discussed options, and then they give us a whole plan of what they're planning on doing. First diagnostic lumbar facets at what levels, and that they plan to follow with the RFA if it's you know, if they have positive results from the diagnostic. So this provider was able to submit 8 pages of documentation that included the request form and had absolutely everything they needed to have their request affirmed on initial determination. And then here's one more example of a good example. And again, you can see that we have the request form filled out pretty much the same way as the last. So again, we have the CPT, we have that they're using the 50 modifier, which signifies bilateral. If it's left or right, you can use left or, you know, the LT or the RT if you're only going to do one side. 1 unit of service, and they again have said bilateral, and this one is C3-4, and this is going to be for the second diagnostic MBB. Again, CPT code here, second diagnostic MBB. So if I go back to the slide deck, and this is all the information that's needed for your first and all other requests, as well as all other requests. But here's the additional information that we need for the second diagnostic MBB. So at least 2 weeks in between the diagnostic injections, and then we need to have evidence that the first injection provided 80% or greater relief in the primary pain, and the second must be performed at the same level that the first was. So again, as we scroll down into the documentation, their scheduling instructions, again, already told their schedulers that's what they're planning, the second diagnostic at C3 to C5, and they're planning the medial branch block. All right, so this is information on an update after the patient's first block. So the patient was contacted. That patient did report 80% reduction for 6 hours in the axial pain after the first block at the areas of C3, 4, and 5 via medial branch block from their last appointment. So prior to the blocks, functional assessment and ODI was assessed and documented, and that as well was contained in the documentation. The symptoms have failed to respond to greater than 12 weeks of PT, home exercise, over-the-counter, prescription pain medications, activity modifications, etc. That their little history, axial neck pain increased with the facet loading, no radicular symptoms or signs. Given her response to the first block, the physician recommended the second bilateral at the same levels. So the medial branch block is what they plan to do again, and this just tells us they're going to be seeking approval then after that for radiofrequency ablation. So if they have a good second one, they want to proceed with doing the RFA. All right, so again, information here, bilateral nerve blocks is what they perform. This is the information from the first procedure. And information about the neck pain, the severity, what they've tried, the history, the stuff that came in when they did their first request. They submitted also with their second request to show us what they had done for the patient. And so they basically hit all those points that we reviewed. We did know that the second one was going to be scheduled at least 2 weeks after. We've seen that that person received 80% response from the first one. So that was all documented. And this request actually met all those indicated markers that we went through in the slide deck yesterday of everything that they need. So they had all the information identified in their request form. They had information on all of this, as well as, since they were moving to the second diagnostic MBB, all of this information as well. All right, so that takes us to the end of the documentation that we are going to show. Now, remember, I included yesterday's slide deck, but if you did not join yesterday, there's a few things on the slide that I want to apologize for and show you again today. The first one is this new checklist that we have on our website for Facet interventions. And that's why I really encourage you, make sure you have this handout and that you've documented that, because we provided you a link right to this checklist. And our CMDs, medical directors, as well as our medical review staff, they did an excellent job preparing this checklist for you to go through and show you what types of things that you need depending on the intervention that you're doing. And then as you scroll down to like slide or page 3, it goes through the algorithm of Facet interventions and what the usual outcomes are. So, you know, if the patient has the pain and they are a candidate for a Facet intervention and they're a candidate for an RFA, and you go through the yes/no questions, and it kind of leads you to the information of what should happen next, or primarily what happens next. And then you can just make sure you have the documentation that supports all of those things, as well as some additional information, you know, on the last part of the slides too. But if you, I'm going to go to WPSGHA.com. If you don't have the slide deck or you don't know where that link is, how can you still find that information? You can simply go to our search mechanism on our website and put in Facet checklist. And I probably spelled that wrong, but at least the search came up. And you can see, then you have the ability to download that and you get right to it. All right. So in the interest of time, since we are right at call end time, maybe a few minutes after, I'm just going to give you a little bit of information. If there are questions that we did not answer for you in the chat, I will make up a list of questions and answers and send those out after the webinar to everyone that participated. But I do want to make you aware that there is a free National Provider Enrollment Conference that's being hosted in conjunction with CMS and Noridian Healthcare Solutions. It's an annual provider enrollment conference, and it is free to you to go. And that conference is going to be August 28th and 29th in San Diego, California. We do have a link on our website, as well as if you have the slide deck from yesterday, you can use this link to go out and register for that. Again, it's a great conference. It represents the largest gathering of providers and suppliers for provider enrollment issues, you know, and CMS has the opportunity to address issues and questions from a large, diverse, you know, population of providers. All right, so I'm sorry we had to rush a little at the end. We did get through all our information and great information for you to have, and I really hope that this really drove home what types of things that you should have in your documentation and your request form so you can get those Facet intervention requests you can get that provisional affirmation on the first request. On behalf of myself and Mary, as well as all of Medical Review, I want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.